So I am going to be doing a sterile technique lab station, and again, I'm trying to make this similar to what I think the testing experience will be like. So this example that I'm doing is actually up on the blackboard. It's the Sally Field example. The only difference is I actually typed up the S-bar myself, and then I've changed a few things so that I can do because there's three different options. Obviously, there's the straight cath, the PICC, or the wound. So I want to practice with all three. So I just retyped the scenario and tweaked it so that I could do the ones that I wanted. So when you come to the station, they give you their little spiel, and then at some point you have to start it. So I have a timer here. I'm just going to start the timer. I'm trying to do this so you can see. All right, so I'm setting the timer for 30 minutes, which means I need to go. Okay, so I would probably gel my hands real quick just to make sure that I do that. So gelling my hands. All right, so sorry, this isn't working. And when I was practicing, you could actually read this. All right, so Sally Field, she was admitted 3 days ago for surgical debridement of a non-healing venous stasis ulcer on her left lower extremity. Her background, she has a history of hypothyroidism, multiple sclerosis, type 2 diabetes. She's taken metformin, and it's diet controlled with metformin, and had a myocardial infarction 1 year ago. She had a peripherally inserted central catheter, a PICC line, inserted 3 days ago for administration of antibiotics. Her assessment. She's awake, alert, oriented to time, place, person. She did experience some nausea postoperatively, which was relieved with medication. She can have another dose at 1700 if needed. She's been drinking water and tea with no reports of nausea. She gets out of bed to the chair with assistance and does report feeling weak and off-balanced. In the post-anesthesia care unit, the PICU, patient was unable to void and required intermittent urinary catheterization. Patient last voided 500 milliliters of clear yellow urine with post-void estimated residual of 20 milliliters. Patient has a wound dressing to the left lower extremity. The dressing was changed by wound nurse 1 hour ago. The wound looks red with granulation, no odor noted. The dressing is dry and intact. Mrs. Fields does report pain at the surgical site between 2 and 6 on the numeric rating scale. Patient has a PICC line in the right upper extremity. Dressing has not been changed since PICC inserted. Dressing is dry and intact with no redness at insertion site. So this one is obviously a little easy. I don't think they're going to make it quite that easy in the real scenarios to make it that obvious. At least that's not what I have found. So here are the orders. Hopefully you can kind of see this a little bit better. Sorry, it's hard for me to get the camera and be able to read it myself. So she's on a 140 gram carbohydrate diet, no concentrated sweets, activity out of bed to chair with assist, vital signs every 4 hours, CBC and serum electrolytes, BUN, glucose daily, obtain capillary blood glucose before and after meals at bedtime, see medications for insulin, bladder scan after each void if patient has not voided for 6 hours, intermittent catheterization using sterile technique if post-void bladder scan estimated volume is greater than 200, or if patient unable to void within 6 hours, sterile dressing change to wound on left lower leg every 12 hours, clean wound with normal saline, pack with sterile 4x4, cover with sterile 4x4 and ABD. Sterile PICC dressing every 3 days. And then I have the vital signs, the laboratory results, which I really don't need for this one. But what I do want to look at is her INO, because I want to know what her last void was. So it's 1700, so I actually had to write that in. So 1700, she drank 120 milliliters of water, 500 milliliters of urine she put out, and 20 milliliters of her post-void bladder scan was 20 milliliters. So if I go back to my orders, it says intermittent catheter if patient has not voided within 6 hours, or if her post bladder scan is less than 200. So this patient has voided 500 milliliters, and her post-void was 20, and that's at this time now, so I do not need to scan her. I do not need to straight cath her, excuse me. So let's go to the wound. It says that the dressing needs to be changed every 12 hours. I got in my report that it was just changed by the wound nurse 1 hour ago. So it's not the wound. However, I did get in a report that she had a PICC inserted 3 days ago and that the dressing has not been changed. And then when I go to my orders, it says that it needs to be changed. The PICC needs to be changed every 3 days. So I know that today this patient would need to have her catheter changed. Oops, I just shot what I needed. Actually. So, excuse me here. So I would then check here that I'm going to change the PICC. I would give this to the CE, and I would hope that they would tell me to continue. Now I'm actually going to try to switch this, and so you can see if you can actually see what I'm doing. Sorry, I had it the wrong way. So hopefully you can see my workstation so you can see me do this. So, okay, I need to gel my hands. You want to gel your hands before touching a patient. I want to take this and I need to identify the patient. So I have here, I have a name. Here it says, I don't know if you can see this. Sally Field, date of birth 1/21/1961, 1/21/1961, medical record number 26532, 26532. And I'm sorry, I think the problem is that there's a window behind me, and when I did this last night it was nighttime and it worked much better in the dark with the light on versus having an open window. I think the lighting is all screwed up. Okay, so I've identified my patient. I think part of this for me is how it's set up. I think in the video that the college shows, they kind of keep everything to her dominant hand. So that's how I try to set it up. You can set it up however, when you get to the station, you can set it up. So you have to set it up the way that is proper and the way that works for you. So I'm right-handed, I'm putting it to my right. I have the trash can right on my right hip. And then I have the catheter kit, and I have the sterile gloves. So, out of the way. And I do have a watch. I have it out and ready to be used, not actually on my wrist. Okay. So I'm opening the kit, the sterile catheter kit, and it ripped. I'm not having luck here. This kit is like, it ripped and it's falling apart. Okay, so I'm trying to very carefully, I still am not really always positive on the best way, but I know that you want to be really careful taking this mask out. I'm holding it by the string, and then right here in the center, you want to, even though you're touching it with your bare hands, you still want to act as if it's keep it as sterile as possible when putting it on. I believe. Okay. So I have the mask on. I need to now put on a pair of clean gloves. Try to be real careful to not reach over my stuff too much here. So I have here a dressing just to check it. Of course, according to this hasn't been changed since January 2017. But anyway, the date should be 3 days from today. It should be about 72 hours since the last time that this dressing was changed. So we're trying to very carefully take this off. I just have a folding lumen coming out of a plastic container that I think it was one of the PICC kits. It works for me. I have it scotch taped, but I do have a couple of marks here so I can look at it and see that it's at the 1 centimeter mark. So I'm taking that off. I'm now taking off my gloves. I'm going to gel my hands, cleaning my hands again. And now I need to put on my sterile gloves. So I have a kind of tight workspace here. You gotta bear with me. I actually have a big table. I just have too much stuff on it. I'm like a clutter person here. I can't stay organized. The stuff's everywhere. Okay. These are the standard 7.5 gloves that come with the school's lab kit that you can purchase. 7.5 seems to be about where I am. I find the wound is the one to make sure that you really have gloves that fit you well, because you don't want to be touching the edges, but for this it doesn't really matter to me. As long as I can get the gloves on my hand, I'm usually okay. Okay. Oh crap, my pinky finger didn't make it. Oh, it did. It did. I thought my pinky finger wasn't going in. Alright. Okay. I have on sterile gloves. So I'm going to take this little scrubby thing and I'm going to break it. And I'm going to use my pinky finger and I'm going to scrub back and forth. For 30 seconds. I do have a watch. I can see it, but I can't show you because then I'll break my sterile hands. I've been doing this for about 5 seconds now. 30 seconds I think is what we're supposed to aim for. Okay, so I am now at the 30-second. But now I have to be really careful that this pinky stays clean. I like to turn at the waist, and my trash can is right there, so I can drop into my trash can. And then this hand is still sterile, so I'm going to try to avoid this left hand and use my right dominant hand. I'm going to pick up this Tegaderm, but what am I forgetting? So I really need to let that dry for a full minute. So it's been drying for 20 seconds now. And I also, of course, want to look for any redness or swelling to the site or drainage. And I want to really make sure I have the right mark. So it's marked at 1 centimeter from the skin. I don't see any swelling. I don't see any drainage. I don't see any redness. I'm at 40 seconds now for the drying. I think that you're supposed to let it dry until it's dry. I would say at least a minute. I've heard that some of the mannequins can take a long time to dry and that the CE may just tell you to continue, but I don't know. Every CE is probably different. Okay, so it's been a minute. To me, it looks like it's dry. I don't see any moisture at all. I don't think I ever really did. Oh, and see, really quick too, I want to make sure I take off this, or just save it, I guess. I gotta make sure I save that piece of tape here. Okay. So again, I'm keeping that pinky up and out of my way. And I'm going to put this right over. I'm using my left index finger to hold this down and trying to keep that left pinky up and out. And you want to make sure you save the little strip that has the thing on it to write the date. And if not, I think the stations have tape, so you could always use tape if you had to. If their stations have tape. I actually don't know. I didn't do this one. Okay, so the Tegaderm is on. I'm now going to take off my gloves. I'm going to gel my hands. I'm gelling my hands again. I'm going to tape this little thingy-majiggy. I'm going to write the date. I don't even know what today's date is. Is it the 20th? I don't know, something like that. And I know that it was going to be 1700 because that was the time I wanted it to be, and my initials. So the date, the time, and my initials. And then I'm going to put this over the pigtails so you can kind of see. I'm going to just pick this up so I can show you. So the pigtails, I still have plenty of time. I'm only at like the 18-minute mark. So I'm just going to quickly throw away my stuff. I need to write my nurse's note. So let's see. And again, I'm sorry this is such poor quality. Like I said, there's a window behind me and it's really screwing this up. Okay, at 1700, changed PICC dressing per orders via sterile technique. No redness, edema, or drainage. Noted. Measures 1 centimeter from skin mark. Sutures intact. And I think as far as satisfying all critical elements, I think that I have, but I just usually like to write something about the patient. Patient denies any discomfort to site, covered with sterile occlusive dressing per orders. Something like that. And then my name and Excelsior College. And then, as you can see, I'm at the 15-minute mark. So we have plenty of time at this station. It's the medication station that I wish we could add the time that we don't use. I wish I could add these 15 minutes onto my medication station. Wouldn't that be nice? So I guess you can kind of see that again. I'm sorry that the quality was so bad. And my little mannequin here, all it is a Foley catheter that I have coming out of a PICC dressing kit. And I just taped it on there, and I drew the little, with the permanent marker. I don't think I can get it to focus enough to see it, but then with the permanent marker, I drew the lines. I mean, it works for me. All right, I think that's it. Thank you.